So we're going to move on to the question and answer part of our forum today. Give you an opportunity in the audience to make comments or ask any questions. So I'm going to call the panel members up to the front. We're going to have Dr. Andy Ignacheski, Gordon Francis, and Melody Young. And in addition, someone that you haven't heard from yet is joining the panel, and that's Dr. Yasmin Grohl. Yasmin's a UBC clinical assistant professor and a cardiologist at St. Paul's Hospital. And she specializes in echocardiography and in treating pregnancy and heart disease and adult congenital heart disease. So if our panel members will come forward, and we will be taking questions from the audience.
So that's the thing that people often want to hear is an answer to that simple, easy, how do I just do it? With belly fat, that's often, as Dr. Francis had pointed out, the most dangerous fat that you're carrying. So you talk about apple and pear shapes. It's actually more healthy to have fat around your butt than around your belly. Because when you think about your internal organs and having that extra fat around there, a whole host of not so great things happen in terms of heart health and inflammation, things like that. So again, that's boring. And the thing is, prevention is not sexy. It doesn't have headlines. Who wants to hear about eating fruits and vegetables and getting out and putting your runners on and going for a walk? But really, that's what's going to get that belly fat. The first step is that foundation of consistent aerobic activity, at least trying to get that minimum of half an hour to an hour. Once you have that foundation, then doing some strengthening abdominal exercises and toning can help, but there's no magic answer that I know of that can just automatically reduce those inches. So it's a combination of the exercise as well as the eating, because if you're doing the exercise but then you're eating way too many calories, that's not going to help. I've also heard beer can go right to your gut too.
Oh no.
I'd also say that if you exercise every day, and even if you don't lose weight, you're helping yourself. You don't have to be losing weight to be improving your health. You reduce your risk for diabetes, for example, just by exercising every day and walking for half an hour every day, even if your weight doesn't go down.
And definitely, when the other component is the strength training. So oftentimes people will find that the scale doesn't change in terms of their weight, but they find that they lose inches. And you might have even seen that with friends and colleagues where all of a sudden you've seen them, you're like, wow, you look really different. Their weight might not have changed on the scale, but it's the inches, and that's with muscle, it weighs more, but it's more compact. So I think many of you have probably seen pictures of the person that weighs, let's say, 180 pounds. One person is X% fat, another person is a lot less % fat and more muscle, and it's just much more lean muscle tissue.
Okay, other questions? Hand up. Okay, thank you.
How many heart transplants do you do in a year, and is the availability of hearts a real serious problem?
Good question.
So, heart transplant is such an unusual procedure. Unlike anything else in cardiology, where this is purely driven by availability of the organs. And when you think about it, a loved one must die, and the family has to give up the organ. And it all has to happen within hours after somebody's death, which is often totally unexpected because the donor hearts come from relatively healthy people who died in accidents or otherwise unplanned death occurrences. In BC, we performed on average between 15 to 20 heart transplants a year, which in the olden days was certainly not enough, and people who were waiting for the organs often died on the waiting list. Unlike any other procedure, there is no valve or something sitting on the shelf that we can use at the time when somebody needs it. It's just so simple. Somebody has to donate the organ, that organ has to fit with the prospective recipient, and then the operation can take place. With an LVAD, which Chelsea so eloquently explained to you, many more people have a chance of surviving, waiting for the appropriate transplant donation. I suspect that in the future, as those pumps become more and more miniaturized, we probably will be doing that instead. Tomorrow, just so you know, we are looking for the first time at a total artificial heart, and this would be first in Canada if we ever decide to use it on an appropriate recipient. There's lots we can do to increase the donation rates in BC, but I do not believe that we will ever be able to find enough organs to fit into potentially hundreds and thousands of people who would benefit from that procedure.
So until the technology is there, talk to your families about your wishes around donation and fill in those cards so people know.
Yeah, no longer driver's license. This is now you have to make an active effort to put yourself on the organ donation registry.
Next question.
First, I want to excuse myself for my broken English, and I would ask what you would recommend for 85 years old man who has a one lung, and what is walking, what exercise I should do, and is it downhill walking useful or only uphill? And since I have a short of that, I cannot go uphill very much, very slowly. Is it useful or not? And beside of this, I have atrial fibrillation and congested heart failure. So what kind of exercise I can do it? Last year I could walk, I could bike at 30 kilometers, but now not anymore. What is exercise for that case? Thank you.
Thanks for the question.
Well, first of all, I think it's important to figure out why it is that you cannot do things you could do a year ago. Again, congestive heart failure and atrial fibrillation are two examples of chronic cardiac conditions that are substantially on the rise in our society. Again, we do have access to what's called Heart Function Clinic, which is the biggest heart failure clinic in Canada, where we look after people with heart failure, often provide advices of the types that you ask. We also have an AFib clinic, which is first in BC, atrial fibrillation being the condition on the rise. I would seriously question of why it is that you cannot do things that you used to do a year ago. I don't know your circumstances, but then nothing happens on its own. An aging process cannot explain such profound decrease in functional capacity. Either your heart failure is advancing, congestive heart failure advancing, and if that is so, you need to see a doctor to get a life-saving medications. Physical activity in heart failure improves quality of life, prevents hospitalizations. Unfortunately, we do not have data that it shows that it prolongs your life. It prolongs your life at home. And the exercise program for people with heart failure, it's like a pill, like a medication. It should be prescribed. And by that I mean, if you don't do too much of it, just too much of a good thing, you can harm yourself from it. If you don't do enough of it, then obviously you don't get any benefit. We use identical fit exercise prescription of the sorts that Melody just showed to you. Walking uphill or downhill, the best thing is walking on flat at the level. If you don't want to have an exercise prescription or a treadmill test that would allow us to come with a more detailed, is the walk sync test. It's 30 minutes a day, most days of the week, with proper warm-up or cool down, not going up the hill. So.
Thank you. Yeah, lots of hands here, so let's try and get to more questions. Yeah, someone will get to you in a minute here. We got here and here, these ladies. Yep.
Hello. Is there a relationship between weight in any form, belly fat, and heart issues?
I love these kinds of questions. There was some recent, media around a book about the wheat belly, and I think that it kind of brings up sort of, I think with society and the way our food has evolved, that there's some people that have sensitivities to wheat that may have a more difficult time digesting it, metabolizing it, and it affects people in different ways. I know that some patients say that, when I cut out carbs or bread, I feel so much better, I have so much energy. I think it's not necessarily that it's wheat specifically, but it's looking at your whole dietary pattern of what you're eating and what sort of works for you. Some people are sometimes what we call more hypoglycemic, where they're more sensitive to a lower blood sugar. And the type of carbohydrates they're eating, because carbohydrates is sort of the group of foods that wheat falls into, bread, pasta. So I think it becomes one, the grains or the carbs that you're eating in your diet. What kind of carbs are you eating? Are they whole grain? How much fiber? What is the combination that you're eating it with? Oftentimes the people just have carbs on their own and not enough protein with that, or even a little bit of fat. Then that can also really bring swings to your blood sugar. So in terms of clinically proven trials that wheat is necessarily sort of a factor for specifically belly fat, that hasn't been established. A lot of the materials out there are more anecdotal and information that's being pulled together, but in terms of trials actually showing that, there hasn't been that. But not to say that for some individuals, having certain types of carbohydrates may give them specific things that it may be a little bit more difficult to lose weight. It may be harder to control their blood sugars. The key things with carbohydrate intake is looking at the amount of fiber, how much you're having, when you're having it, and really looking for those whole grains and the higher fiber intake and the portions. Does that answer your question? Thanks.
Okay, there's two ladies here in this row when you're ready. Okay, up to here.
That was a really interesting presentations. I'd like to know what percentage of people with high blood pressure are able to decrease or eliminate their medication with lifestyle changes and be able to maintain it on the long term.
Blood pressure is a ubiquitous condition. 90% of us, 50 years of over, will be told that we have high blood pressure. It's the highest contributor to stroke and heart disease there is. That even over surpasses cholesterol and tobacco smoking. Worldwide, #1 killer. The blood pressure that we consider to be normal isn't. It's just a figment of our statistics that we say your blood pressure should be 140/90. It should be 110/70. That's what our forefathers had for a normal blood pressure. There is nobody in Western society who has blood pressure 110/70. We would essentially have to put the whole society on medical treatment that's expensive and often associated with side effects. Lifestyle in early stages, in so-called pre-hypertension, can delay or avoid contribution from blood pressure. Diet, exercise, avoiding salt, decreasing alcohol intake can lower your blood pressure about 15 from the top number, about 10 from your bottom number. So just look at your blood pressure, what it is, try to subtract 15 from the top number and 10 from the bottom, and see if the blood pressure would fit under the criteria. Generally speaking, maybe a third of people can do it, and the problem for us is we don't know how persistent that change is. Can you sustain your lifestyle changes over a prolonged period of time to stay under the level where we diagnose high blood pressure? That research has not been done yet.
I would add to that you get about as much lowering of blood pressure with regular exercise as you would with taking 1 or 2 medications for blood pressure. So the two add to each other very well.
Just as a side, the other comment I was going to make about some of these blood pressure medications is oftentimes we'll run across patients who maybe have been put on a blood pressure medication for another reason. For example, they may have had a heart attack or have got known coronary disease. And some of our blood pressure medications have also been shown to sort of slow the progression of coronary disease. And often patients will say, well, why am I on this blood pressure medication? I don't have high blood pressure. I think it's really important, depending on what your medical scenario and history is that, you know, it's always important to recognize that you may be on a medication for another reason, although that medication might be recognized as, you know, as predominantly an antihypertensive agent, for example.
Okay, this lady here.
Thank you, sorry. If you have a heart valve that is not functioning at a perfect level, but is slowly progressing and presents no immediate catastrophic possibility, but you know it's going to progress, is there any lifestyle change you can make that might accommodate that particular problem?
As far as lifestyle changes with heart valves, nothing specific in the literature has been shown. Some of the things that we've thought about have been, you know, cholesterol reduction, perhaps. You know, if your cholesterol is well controlled or you're on a medication that reduces cholesterol, that might slow the progression of prosthetic valve disease. But in fact, I don't think we really know the answer to that. And so that's why part of the process really is just watching and waiting and intervening, when there's a reason to intervene.
Okay, probably only time for maybe one more question. And this lady right here. There you go. There's the mic for you. Thanks.
I have one of these blood vessels that's decided to come up into the hollow of my neck. And when I get my heart rate up, it's always pulsating there. But when I really go out walking and try to walk fast, it gets the heart rate up, and it really pulsates quite badly, and that stops me to go down to a snail's walk. And does this interfere with the breathing when it pulsates so heavily? I hear it's very dangerous to operate on it.
I think we're having a little bit of trouble maybe understanding. There could be, you know, a lot of reasons why you have this pulsating in the neck, whether it's because, you know, one of the arteries in your neck is blocked, or whether it's just that one of the arteries is now more prominent and you're more aware of it. I don't know, have you had
Well,
that?
I understand it's a blood vessel that has come up into my hollow of my neck.
Right. I guess the first thing really would be to have someone evaluate that and see, you know, if it is an aneurysm or something, or is it just...
No, it's not, no.
Okay. So then if it's just an artery that's become more prominent over time, I think oftentimes people are just more aware of pulsating when you know that something is there. It really shouldn't affect your breathing, per se. If it is truly affecting your breathing, then again, I'd be concerned that maybe it's something else. But that in and of itself, it doesn't sound like it should affect your breathing at all.
Okay, well, thank you to our panelists for bringing your expert advice and information. Thank you to all of you in the audience for attending this forum and bringing your questions forward. If you haven't already, please fill in your name and email at the registration desk back in the lobby, and we'll send you a copy of today's presentation. And it's a chance for you to enter a prize draw, too, if you fill in some responses to our survey about this event, because we want to learn from you about similar forums. And to learn more about how you can support St. Paul's Hospital and the Healthy Heart, or our Heart Center program, you've seen the email, www.helpstpauls.com. If you go to that website, it will also help you link to a video of today's forum, and you could share that with other friends and family. So if you have any questions about today's event, or still some outstanding questions, we have a number of our team from the St. Paul's Hospital Foundation in attendance, and they can help respond to your questions at the end of the event. So foundation members, just put up your hand, and so over here and up in the back. Great. So that concludes our forum. Again, thank you very much for your attendance. Keep doing all that you can do to keep your own hearts healthy. And when you're in need of some further assistance, St. Paul's Hospital is there with their strong team to help you out. So enjoy the rest of your day. Thanks, everyone.